President-elect Donald Trump has selected Robert F. Kennedy Jr. as his forthcoming Secretary of the Department of Health and Human Services, a decision that will further challenge Senate Republicans' allegiance during the confirmation processes of Trump's contentious appointments. On Thursday, Trump confirmed the selection, corroborating CNN's prior report, expressing his enthusiasm to disclose the choice. Trump stated in a post on X, "The paramount responsibility of any administration is the safety and health of all Americans, and HHS will significantly contribute to safeguarding individuals from detrimental chemicals, pollutants, pesticides, pharmaceutical products, and food additives that have exacerbated the pervasive health crisis in this country." Mr. Kennedy will reinstate these agencies to the principles of gold standard scientific research and transparency, aiming to eradicate the chronic disease epidemic and to rejuvenate America's health and greatness. Kennedy, who accepted the offer on Thursday, has long been one of the nation's most notable anti-vaccine conspiracy theorists, consistently disseminating inaccurate conspiracy theories regarding the safety and efficacy of vaccines. He has been in Palm Beach, Florida, for several days subsequent to the election. In a statement on Thursday, Kennedy underscored the necessity of eliminating corruption from the department and pledged to offer Americans transparency to facilitate informed health decisions. "I anticipate collaborating with the over 80,000 employees at HHS to liberate the agencies from the stifling influence of corporate capture, enabling them to fulfill their mission of restoring Americans as the healthiest population globally," Kennedy stated. If appointed as the chief public health official in the nation, Kennedy would manage the implementation of the Affordable Care Act, Medicare, and Medicaid. Although Trump has shifted from pursuing a complete repeal of Obamacare, it remains uncertain whether he and his health professionals will unveil a proposal to enhance the legislation, as Trump pledged throughout his campaign. Kennedy would also participate in any modifications that Trump and congressional Republicans seek to implement regarding Medicaid, which offers healthcare coverage for low-income Americans. During Trump's initial term, the agency attempted to implement job requirements, which were predominantly obstructed by the judiciary, while legislators endeavored unsuccessfully to diminish the program's budget. The program, encompassing approximately 72.5 million Americans, is anticipated to be a focal point during Trump's second term, particularly as the GOP aims to identify savings to counterbalance the tax reductions they aspire to enact. Kennedy's appointment, initially disclosed by Politico, is significant considering that mere days prior to the election, Trump's transition co-chair Howard Lutnick informed CNN that Kennedy would not be receiving a position at HHS. He will not oversee HHS? He was interviewed on The Source with Caitlin Collins. Lutnick replied, "No, certainly not." The response incited significant turmoil among Trump's circle, with Trump explicitly indicating to Kennedy that he would render the final judgment. Kennedy launched his presidential campaign last year, initially as a Democratic contender against President Joe Biden, and subsequently as an independent, primarily concentrating on addressing the chronic disease epidemic. He advocated many initiatives designed to reform food safety and environmental regulations, advocate for holistic health, and reorganize public funding for vaccine research. During the concluding days of Kennedy's campaign, he engaged in several meetings with Trump, wherein they deliberated the potential for Kennedy to endorse Trump in return for a position within his administration. Kennedy halted his campaign in August and backed Trump on the same day. In October, Trump suggested that Kennedy would manage a public health portfolio during a rally at Madison Square Garden in New York City, stating that he would allow Kennedy to go wild on health, go wild on the food, and go wild on medicines, if re-elected. On Thursday, shares of leading